I had done a regular blood test in 1999, and my liver enzymes were found raised. So upon their advice, I repeated the test, and again, the enzymes were raised. So I did further investigation. I took a HCV test, and it was positive. And I realized the only time I had any sort of blood transfusion was when I had dengue, like 9 years before, 1991. I was hospitalized and my platelet level was really low, and as such I was given 4 bags of platelet transfusion. So I reckon that must have been the time where I was given tainted blood. Yeah. Back then, hepatitis C was not something widely known. In fact, it wasn't talked about at all. I had heard of hepatitis A and hepatitis B. And in fact, I was vaccinated for hepatitis A and hepatitis B. Very worried. And of course, I was never seriously ill before. When I heard I have hepatitis C, I began to read up more about it. And I knew that it is something pretty serious. Yeah. No, actually they were very not so concerned, you know, because to them I did not display any symptoms. I was not in pain, you know, unlike the other illnesses, right? So they didn't think that it was serious until they understood more about the disease and they read up more about it, and then they knew that it is serious and that I should seek treatment immediately and not delay anymore, because this is kind of like a long-term illness. If I delay further, it will develop into a serious health complication, right? Yeah. At that time, the symptoms were just tiredness, you know, and flu-ish symptoms, something that you can dismiss as a regular day-to-day symptom, you know. Because of my hectic workload as well, the tiredness is like normal to me. Had I not done my blood test, I wouldn't have known that I have hepatitis C. Upon diagnosis, I was, you know, very worried, and then I had gone to a private hospital, and I've seen a hepatologist, and at that time, interferon just came about, and I took that for 12 weeks. It was in a form of injection. I have some side effects: hair loss, loss of appetite, which of course caused weight loss, which I welcome. I didn't mind the weight loss, and fever, and forever feeling like heavy-headed, you know, headache kind of thing. Yeah. So I had that kind of symptoms. 6 months after that treatment, I did a HCV test again. It was detected again. The virus was detected again. So I know I had a relapse. Then I undergone the same treatment again for a longer duration, 24 weeks. And as you guess it, 6 months later, the virus came back. And after that, another drug came on. So I had a combo treatment, the first drug and the second drug, for 12 weeks and then 24 weeks. And again, I had relapse. So I stopped treatment because I was disillusioned already, you know, the current treatment didn't work on me. So I stopped, and I thought life goes on. I had my 2 children. I conceived and had 2 children, you know, because during treatment I'm not supposed to get pregnant. So I stopped the family planning. So after the 4 relapses, 6 months later, I conceived, and I had two girls, back to back, 1 year after the other. And of course, after the relapses, I didn't even want to go back to the hospital for checkup, you know, because I thought no point, because so many relapses, I kind of like gave up. But I did do some checkup lah, monitoring of my condition. A doctor in the government hospital noted that I have not come back for checkups, you know. So she called me and said that, hey, there's a new drug available. Would you like to come back to the hospital? and would you want to go on a clinical trial for this new drug, and which has a better rate of success, you know. So I went back, and that was how I started again, going back to the hospital for checkups. However, that new drug also failed. Even after as short as 12 weeks, the virus was detected again. Then I waited again, you know, until the DAA came in, direct-acting antiviral, right? And that is like a game changer, so-called. And I've been so resistant to all the other treatments. The doctor said this is very promising because I've had hepatitis C for so many years, like around 20 years already. I should go on this treatment as soon as possible. So I purchased the drugs and underwent the treatment. That is at the very beginning when the DAA was available. The cost was very high. So I did purchase the drugs, and I went on it for 24 weeks. It was really good because at week 12, it was already negative, you know. And then at week 24, again, it was negative. And later, 3 months later, it was negative. So my blood test then all showed that my liver enzymes have gone back to normal. Even FibroScan shows the liver condition has improved, you know. So in 2017, I was given the clean bill of health, no more hepatitis C. I must thank God, that during the treatment, I did not get serious side effects, you know. I read about other people having palpitations and serious rashes and being anemic and even having mood swings and even suicidal tendencies, you know. I thank God I didn't have those, and I didn't even take MC, you know, I remember during those treatments. I feel good now, knowing just that, you know, there's no more hepatitis C, that I am cured. DA is just a really simple drug. It's like an antibiotic you take for like 12 weeks. No side effects, and with that, hepatitis C becomes curable, you know. So it's really a hopeful a drug, yeah. And this is so simple. Just take the pills, make sure you take it within a time period given, and it's just so simple, yeah. I can't stress the importance of having a regular blood test for hepatitis A, hepatitis B, and please include hepatitis C as well, which is not included in your regular blood test. Test, treat, and cure with Malaysia Healthcare.